Sat Shri Akal, this is Dr. Vikram from Chandigarh. I'm a cosmetic plastic surgeon, majorly into hair transplant, liposuctions, and all other sort of cosmetic surgery. Today we are going to talk about hair transplant because this is one of the most commonly done procedures in our clinic, and we in Punjab are encountering a lot many patients who, after their hair have been trimmed off, they have a lot of hairline problem. We tackle with such patients apart from the routine patients who are having the male pattern baldness, which is common everywhere in the world. 1 in 3 patients, or let's say 1 in 3 men in northern India, they suffer one or the other sort of hair loss, but they come when they are having a receding hairline and have already gone into pattern 1 or pattern 2 of the Norwood's classification. For the routine patients, let us talk about the causes of hair loss, the treatment for that, the hair transplant, exactly what it is, what are the methods available for curing hair transplant, and what do we need to take care after the hair transplant. Hair loss is commonly because of any sort of stress. That could be the environmental stress, that could be the injury in the body because of the free oxidants available, because of the dandruff, because of the gene which is present in the males, which cause a lot of hair fall in the frontal and temporal areas. Whatsoever the cause may be, we see what exactly is the reason behind it and try to help the patients in forms of the medical and surgical treatments for hair fall. Our focus for the talk today would be the surgical treatment for hair fall. We are these days following the FUE method of hair transplant, which has served out to be a successful method of hair transplant for past 5 to 6 years in our hands. We started off with strip method, but because of some discomfort which most of the patients feel after strip method, we shifted on to FUE, and since then we've never looked back. We are doing more than 3,000 grafts, more than 5,000 grafts in certain patients by FUE method alone without the help of the strip method. Now, FUE method, let me elaborate on it. It's basically plucking out single follicular hair unit with the help of the motorized or non-motorized punches, which are micro punches, 0.8, 0.7, 0.9, 0.95, 0.1 millimeter punches. And once the hair have been extracted, they are transplanted into the bald areas. These areas, they start growing hair after 3 to 6 months of the transplant. Now, the post-operative care which most of the patients ask concerning hair transplant, I would like to tell you today. Once the patient comes to us, either through the internet or into our OPD, he's undergone some blood tests. Some blood tests are done, and then after he is fit for the procedure, we give him a date, and 1 day before the procedure, we start him off on some medicines for relaxed sleep overnight and some antibiotics plus a special shampoo. On the morning, he comes early in the OPD and he is trimmed off and the hairline is planned. The trimmed hair are again scrubbed out and the patient is taken into the OT. It's 6 to 7 hours procedure. After the procedure, the patient needs to take care of scrubbing his hair. We teach him the special technique of shampooing, which needs to be followed for 5 to 6 days. Beyond that, the 8th day, he can wash his hair normally, and the scabs would fall off within another couple of days, say 10 days. He needs to avoid any sorts of t-shirts or any caps which can cause the tangential force on the hair which are transplanted.